Hello, everyone. My name is Caitlin Bafis-Lasky, and I'm the National Scientific Director at Lymphoma Canada. And I'm very pleased to welcome you all to today's educational webinar hosted by Lymphoma Canada on caregivers and how to help yourself and the patient. We appreciate those of you being able to join us live today to learn more about being a caregiver for a lymphoma or CLL patient. This is a unique position. It can vary greatly depending on how involved you are. There are many challenges that caregivers can experience throughout the patient's journey as well, and it's important to understand and know what to prepare for. As a care partner, it's important for you to also take care of yourself while supporting your loved one. Going through the lymphoma journey is difficult for both the patient and the caregiver, but there are resources that are available to help you. This webinar will review the many ways that caregivers can provide support and how caregivers can best take care of themselves, including their physical and mental health, throughout the patient's lymphoma or CLL journey. Now, before we begin the presentation, there are just a couple of items to note. This webinar is being recorded and will be posted on Lymphoma Canada's website later this evening. You will also receive an email by the end of day today with a link to be able to watch the recording. Now, this virtual software does not allow for you to share your video or microphone. Therefore, if you would like to ask a question, please go ahead and type the question into the questions box, which is located at the bottom of the control panel on the right-hand side of your screen. These questions will go to the moderator, which will be myself for the session, and I will ask these questions to the presenters at the end of the session, and we will try to get to as many questions as possible. Next slide, please. Perfect. So I will begin by presenting the first part of this presentation, sharing valuable results from the 2020 Lymphoma Coalition Canadian Survey for Lymphoma and CLL Patients and Caregivers. The second half of this presentation will be presented by a social worker, and I look forward to introducing her shortly. So I would like to first start off by discussing a bit about who is a caregiver. If a friend, relative, or someone you care about has been diagnosed with lymphoma or CLL, it is often difficult to know what to expect and how you can support them. Just being there and taking the time to listen and offer practical and emotional support whenever needed is a great start. Being in this role, however, is slightly different than being a caregiver or care partner to an individual with lymphoma or CLL. You are considered to be a caregiver if you're providing for a loved one with lymphoma or CLL who can no longer manage on his or her own. Perhaps you're helping your loved one with daily needs, such as bathing or dressing, paying the bills, and taking him or her to the doctor's office or the grocery store. You may be a son or a daughter, a husband or a wife, an in-law, a neighbor, or a close friend. You may live together, next door, in another city, or even across the country. If you're providing regular assistance to a patient with lymphoma or CLL, you are considered to be a caregiver. Next slide, please. In April of 2021, Lymphoma Canada released the 2020 Canadian Patient and Caregiver Lymphoma and CLL report cards and infographics. These reports were developed following the release of a Canadian survey from the Lymphoma Coalition, and they surveyed over 500 Canadian lymphoma and CLL patients and caregivers. These report cards are extremely valuable because they share the Canadian experience, highlighting some of the key issues and challenges faced by this community across the country. There were 63 Canadian caregivers that responded to this survey, providing very unique insights into their experience as a caregiver for both lymphoma and CLL patients. For every lymphoma patient, there is often one or more caregiver that is supporting the patient, either in dealing with practical aspects of medical care and or being emotionally available for the patient. Caregivers were predominantly caring for an immediate family member, with the majority caring for a spouse, followed by a child or a parent. Canadian caregivers were also asked how long they have been caring for the patient. About 16% of caregivers said that they provided support for less than a year, while about 14% have provided support for over 10 years. So as you can see, based on this information, the majority of caregivers are providing between 1 and 10 years of caregiving experience and relationship to that lymphoma patient, showing and providing information that lymphoma can often be a long disease and care can be required throughout. Next slide, please. There are many times when a person with lymphoma may require additional assistance and care, such as when they're going through treatment or experiencing certain symptoms or side effects. There may be other times when they are relatively symptom-free and might not require as much help. Canadian caregivers were asked to list the different ways that they care for a lymphoma or CLL patient. And there are a number of different ways, as you can see here by this diagram. There are a number of different ways that caregivers provide support to patients. The majority of caregivers provide support, such as emotional support, which can include talking and active listening, accompanying the patient to different appointments, and looking for patient about lymphoma, both for themselves and the patient. They also are involved by providing general transport, running errands for the patient, such as picking up prescriptions or helping with shopping, household chores, and talking to healthcare professionals on the patient's behalf. These are just some of the most common ways that caregivers can assist, but there are so many different other ways that a caregiver can help the patient throughout their journey. Next slide, please. Of all the different ways that caregivers assist, the majority found it most difficult to provide emotional support for the patient, even though this was the most common activity that caregivers helped with. And I wanted to share with you a quote from the lymphoma report card from a caregiver that responded to the survey. As a caregiver, how often do I ask my partner how he was doing or how he is feeling? Am I just reminding him that he has cancer? How can I get him to talk about it in a way that is productive? How can I help him accept his diagnosis? Right now, he is suffering with depression. I wish I could do more to help. Now, this is such a powerful message here. Caregivers are with the patient so frequently, and they are an advantage to provide valuable one-on-one support to the patient if the patient is open to receiving it. So therefore, it's important that caregivers have the option of receiving tools, resources, or training that can help them support and communicate with their loved one. Next slide, please. Most caregivers do not have formal training and rely to a great degree on what they learn from the healthcare team and from their own self-education. They are learning as the patient is learning, and they have to cope and manage the influx of information they are receiving as much as the patient is. Through this survey, we learned more about the informational needs of caregivers of lymphoma and CLL patients. Caregivers were asked whether the patient, caregiver, or both of them would seek out information about lymphoma and the different treatment options available. The majority of caregivers responded that both the caregiver and patient actually work together to obtain this relative information. However, there's also a large population of caregivers that look for this information themselves and then relay it to the patient. It's also important that caregivers are recognized as important members of the patient's healthcare team, and that communication should exist with them to help benefit the patient. The majority of caregivers do feel that they are being recognized by the healthcare team and healthcare providers, and do feel assisted, supported, and understood by healthcare staff. Therefore, it's important that caregivers are provided with this recognition and supports and resources to be able to support the patient. Next slide, please. A caregiver may also be very focused on the patient that they are caring for, and they may forget to take care of themselves. It is important to pay attention to your own health and well-being while you are caring for a patient. Self-care also benefits those around you. Canadian caregivers were asked to what extent the following issues have affected them in the last 12 months. Impacts to caregivers that occur most frequently, which includes sometimes, often to always, included being worried or anxious, being emotionally tired or worn out, putting the needs of the lymphoma patient above their own as a caregiver, being sad or depressed, sleeping difficulties, and fear of the patient relapsing. Over to the right of the slide, there are a number of different tips that caregivers can use to help look after themselves. Suggestions include making time for yourself and the things that make you happy, as well as living a well-balanced lifestyle. Later in this presentation, we'll be able to provide further guidance and suggestions. Next slide, please. So I just wanted to summarize some of the key findings from our Canadian Experience Report for Caregivers. Caregivers provide support for many years for lymphoma and CLL patients, and therefore support for caregivers should be provided long-term. Caregivers also find emotional support the most difficult to provide to patients, but it is the most frequently provided. So resources for how to provide emotional support would be very useful for caregivers. There are a number of physical and psychological impacts of caring for a patient, and so caregivers need to be able to help themselves first to then be able to help the patient. And not necessarily all caregivers are still being recognized by healthcare staff, and therefore our HCPs need to acknowledge caregivers and provide them with supportive information and resources to help them caregive throughout this journey. Caregivers need their own support and resources. Next slide, please. So I just like to end off my section with a brief message before I turn over the presentation to our speaker for today. It is very important to take care of yourself. Remember to do so. Sometimes you can get so busy helping others that you forget that your needs are important as well. Next slide. So I would now like to introduce and welcome our speaker for today, Tori Belsberg. Tori is a clinical social worker in Toronto at the Odette Cancer Centre at Sunnybrook Health Sciences Centre with the Patient and Family Support Program. Tori graduated from NYU with her master's in social work and has since been practicing in the hospital setting. She worked at Toronto General Hospital in the Dialysis Centre and then moved to Boston, where she worked at the Dana-Farber Cancer Institute and Women's Hospital, where she found her passion for oncology care. When Tori returned to Canada, she began working at the Odette Cancer Centre and now supports the gastrointestinal oncology and hematology site groups. Tori works with patients to address the physical and emotional challenges imposed by cancer and cancer treatment. She also supports family members and partners in navigating the unique roles and responsibilities of caregivers. Tori dedicates her efforts to providing valuable support for patients and caregivers, and we thank you so much for joining us today to provide our caregiver community with more information. I would now like to turn over the presentation to you, Tori. Thank you, and take it away.
Thank you so much, Caitlin, and good evening, everyone. Thank you for having me, and thank you for all that you do, all of you caregivers in the audience. I'm thrilled to be here as part of a means to support all of you. Caitlin, thank you very much for the warm introduction. Before I start my presentation, I just wanted to share a little anecdote. My colleague likes to send out a calendar every month, and on that calendar, it has special dates like April Fool's and St. Patrick's Day and National Donut Day and all kinds of fun, silly things, and also important dates as well. And actually, this Thursday is Caregiver Appreciation Day, and so I thought that was really timely for the presentation that we're here for tonight. So during my presentation, I hope to identify who caregivers are, what they do, discuss the common challenges and feelings experienced by caregivers, identify the signs of caregiver burnout, explore strategies and ways to cope with the challenges of being a caregiver, identify community resources to support the needs of caregivers, discuss caregiving during the COVID-19 pandemic, and also provide a case example. So just a few simple questions here, and I want you to listen and answer them to yourself. Do you provide practical support, including meal prep, grocery shopping, chores, transportation to someone close to you? Do you provide emotional support to someone coping with a healthcare issue? Do you adjust your personal and/or work schedule to accommodate the healthcare needs of someone close to you? Do you help arrange healthcare appointments? If you answered yes to any of these questions, then you are a caregiver. The National Cancer Institute defines a caregiver as a person who gives care to people who need help taking care of themselves. Caregivers may be health professionals, family members, friends. They may give care at home or in a hospital or another healthcare setting. Care can be provided in many different ways, including practically, emotionally, spiritually, or physically. And care tasks can include meal prep, grocery shopping, bathing, organizing appointments, providing transportation, supportive listening, communicating, advocating, and the list goes on. So just to give you a sense, I know there's participants across Canada, but just to give you a sense of the numbers of caregivers we have in our Ontario community, there are over 3 million caregivers. That means that 2 in every 10 Ontarians is a caregiver. In addition to being a caregiver, caregivers have many other roles and responsibilities. They might also be a parent or a sibling with familial obligations. They might be working a full-time job or in school or both. And I think this is a common challenge that many caregivers experience, that being the balancing of all of these different roles while also caring for a sick loved one. Many caregivers describe their experience of caregiving as an emotional roller coaster. Feelings of shock might present on initial diagnosis, followed by feeling angry that this happened to a loved one. Or perhaps the caregiver feels angry that in addition to everything else he or she is required to manage, he or she is now obligated to take on a role as caregiver. Other feelings include, but are not limited to, guilt, feeling overwhelmed, confused, anxious, irritable, depressed, and at a loss of control. But regardless of what you're feeling, it's important to know that all of these feelings are normal. So be kind to yourself. It's important to give ourselves permission to experience the wide range of emotions that accompany a change in health or role. While caregiving can certainly elicit some distressing thoughts and feelings, it does not always feel overwhelming. In fact, providing care to our loved ones can help us feel connected. It fosters a sense of being proactive. Some studies have even shown that the spouses of cancer patients have reported a strengthening of relationship and a sense of purpose. In addition to the many feelings mentioned above, which of course was not an exhaustive list, caregivers can often feel helpless. At times, it can be challenging to find direction and identify ways to be proactive and helpful. It's important to remember that the little things count and are appreciated. Simple things like active listening, taking our loved one out for a walk, helping with chores around the house, even something as small as setting the dinner table is an action that might not feel supportive, but actually it is. With everything that caregivers do on top of their other responsibilities at home and at work, it is important to recognize the signs of caregiver stress and burnout. Stress can manifest in a number of different ways, including physically, emotionally, and socially. Physical signs of stress can include muscle aches and pains, headache, weight loss, fatigue, sleeplessness, digestive issues, increased use of alcohol or drugs. Emotional signs of stress can include depression, anxiety, irritability, irregular mood, feeling overwhelmed, or difficulty concentrating. And social signs of stress can include decreased productivity at home or at work, or withdrawal from social relationships. Part of addressing caregiver stress and burnout is practicing self-care. Caring for yourself is just as important as caring for your loved one. Sometimes practicing self-care can feel selfish, but this is a misconception. Self-care enables you to re-energize so that you can continue to care for your loved one. When I talk with caregivers, I always like to give the example of putting on an oxygen mask on the plane. And I know it's probably been a while since many of us have traveled, but if you remember the safety demonstration before every flight, you are always encouraged to secure your own mask before helping someone else. You need to prioritize your own health so that you can be well enough to care for others, and the same applies to caregiving. So how do you practice self-care? You can eat a balanced diet, exercise regularly, or ensure some form of daily movement. You can get a sufficient amount of sleep. That, of course, is easier said than done. But it's also important to accept help from others and connect with supports. Self-care includes saying yes to anyone who offers to cook a meal, drop off groceries, take your kids to school if that's appropriate. And for many caregivers, burnout can be debilitating. And at that point, it's important to seek support from professionals like a psychologist or a psychiatrist or a GP. It might also be helpful to explore the possibility of respite care so that you can take a break and recharge. Practicing self-care is critical for caregivers. Taking time for yourself enables caregivers to continue to provide effective care for their loved one. Practicing self-care may feel indulgent, and caregivers may feel guilty doing so, but it's important to maintain a degree of healthy self-interest. Self-care means taking protected time out of the day to do something for yourself. This might include going for a walk, getting a massage, reading a book, meditating, exercising, listening to music, journaling. Self-care should be spent doing something that you enjoy. In addition to self-care, it's important to be familiar with what community supports are available. The LHIN, or the Local Health Integration Network, is the government-supported organization in Ontario that offers home care services to people in the community. Something similar will be available across provinces. It includes case management, personal support workers, occupational therapists, physiotherapists, nurses, and respite care. If possible, it can be helpful to supplement government-supported care with private care. This is sometimes covered by insurance, so it might be helpful to look into your policy if you have one. The visiting palliative care teams are also valuable assets to home care if appropriate, and can be hugely helpful in addressing patient care needs and in turn alleviate some of the caregiving responsibilities. These teams are comprised of palliative care physicians who see patients in their homes and help support a quality of life for those with a terminal illness. In addition to home care, other practical supports like meal programs, transportation services, can help alleviate some of the pressures our caregivers experience. Meal delivery services like Meals on Wheels or the local food bank offer healthy meal delivery options, and transportation through Wheel-Trans or the Wheels of Hope program through the Canadian Cancer Society can be helpful to those traveling to the hospital regularly for appointments and treatment. In addition to practical support, there's also emotional support available in the community through various programs at the Canadian Cancer Society, Wellspring, and of course, the Leukemia Lymphoma Society. These programs offer an opportunity to connect with someone who's been there. Connecting with someone over a shared experience can be uniquely valuable as they understand exactly what you are going through. In addition to peer support, many of the cancer centers, including Odette, have professional supportive services, including psychology and psychiatry, that caregivers are able to access. Other online resources like the Ontario Caregiver Association offer a wealth of support, including articles and webinars that can be helpful to caregivers along their journey. A common concern for caregivers relates to financial needs. Many caregivers find it challenging to balance employment with caregiving responsibilities. Some are able to take a leave from work to focus on their role as caregiver and collect EI benefits. There are 3 types of EI caregiver benefits: the family caregiver benefit for children, the family caregiver benefit for adults, and the compassionate caregiver benefit. If you pay into EI through your employer, you will have access to all of these benefits through Service Canada. As you might all agree, we are living in unprecedented times. Caregiving during the COVID-19 pandemic has imposed additional challenges to the caregiver role. For example, prior to the pandemic, caregivers were allowed to accompany patients to all appointments, no questions asked. Now, the hospitals have imposed strict policies with regards to caregivers, and it can be challenging to keep up. Fortunately, as the cases continue to decrease, so too has the intensity of the restrictions, but many are still in place. For example, patients are only allowed one essential care person to accompany them to appointments, and all essential care persons are required to be vaccinated. This has posed unique challenges to those who have difficulty arranging their schedules, or who have had difficulty obtaining a vaccine, or who don't want to obtain a vaccine. There's also the added stress and pressure, of course, associated with exposing your loved one to COVID-19. Many caregivers work in the community, and the fear of bringing COVID-19 home to their loved one is significant. There is also the need to protect your own health from COVID so that you can continue to provide care to your loved one safely. Of course, vaccine accessibility was also quite a challenge, and for a while, caregivers were worried about being unvaccinated and providing care to the vulnerable. Fortunately, vaccines are now readily available to everyone, but previously this was a unique stressor for many of our caregivers. So I wanted to share with you a case example, and this is somebody who I supported while he was taking care of his wife, who was a patient at the Odette Cancer Center. I've changed a number of details, of course, to protect the identity of this caregiver and the patient, but overall, the story is one I'm sure many of you will be able to identify with and might resonate. So Peter is a 59-year-old male caregiver for his wife. His wife's treatment plan included chemotherapy and radiation, and Peter accompanied her to every appointment. They have 2 adult sons who are away in university. Peter was the sole caregiver for his wife. Not only did he accompany her to all of her appointments at the cancer center, he also took care of her at home by preparing meals, administering medication, providing emotional support, and completing household chores. Over a period of several weeks, Peter began to experience caregiver burnout. He took a leave of absence from work and fortunately obtained disability benefits through his employer. During an appointment with his wife's oncologist, Peter broke down in tears. He was referred to me for support. Peter endorsed many signs of caregiver burnout, including fatigue, sleeplessness, hopelessness, loneliness, frustration, and anger. In providing support to Peter, I validated his emotions and built rapport. I raised the importance of practicing self-care, and while initially reluctant, Peter was able to challenge his feelings of guilt and recognize the benefits of a healthy self-interest for both himself and his wife. Peter was able to engage in a discussion around coping strategies and identified his faith as an important source of support. We explored ways to access support from his church community, including prayer, talk therapy, and practical support through meal delivery. Peter shared that he loves to hike, and we identified a plan to set aside time on the weekends to hike the nearby trails. Peter described a sense of relief in talking with me about his experience as a caregiver and associated stress. In addition to talk therapy, Peter was able to engage in healthy coping strategies, including hiking and prayer. While his caregiving responsibilities continued to occupy a significant amount of his time and attention, being able to identify and address his caregiver burnout enabled him to regain some control over his ability to cope. So I just wanted to review a few key takeaways here. The first being that caregivers play an essential role in the lives of our loved ones. They also wear many different hats and have many different responsibilities. Caregiver is likely not the only role that you play, and it can be challenging to balance all of our different identities and tasks. It's important to remember that providing care to a loved one can elicit a wide range of emotions, all of which are normal. I want to encourage you, as hard as it is, to avoid self-judgment and be kind to yourself, as it can be very difficult and stressful. As a result of that, it's also important to be aware of caregiver burnout and be mindful of your limits. I want to encourage everyone to accept help wherever possible, and most importantly, I want to encourage everyone to practice self-care. I just wanted to include some resources here and some links. So of course we have the Lymphoma Canada Caregiver report, the Local Health Integration Network, that's the government-supported home care organization in Ontario. The Canadian Cancer Society, I've included the link here to the Wheels of Hope transportation program. Wellspring Cancer Support Center is a wonderful organization across Canada that offers all kinds of support to patients and caregivers. In COVID, a lot of their support has been virtual, but they have cooking classes and yoga, support groups, and they're just a wonderful organization. The Ontario Caregivers Association I've included here, as well as the website for Service Canada Employment Insurance. So that concludes my presentation, and I just want to thank everyone for all of the hard work and effort that you put in every day to care for the people that you love. I want to thank you for having me here tonight, and I hope that some of these messages resonated. I hope some of the messages were helpful. And if anybody has any questions, I'd be happy to answer them as best I can. And I want to thank you again for having me here tonight.
Wonderful. Thank you so much, Tori, for this extremely informative presentation. We thank you so much for sharing the importance of caregivers and taking care of themselves and the many different ways they can accomplish this and what resources really are out there for them. So you provided a lot of really great information and also resources that caregivers can access, and hopefully it'll help them to feel supported throughout the patient's journey. We do actually have some questions coming in already, which is great. So just a reminder for those who joined us a little bit later in the session today, you can still type in your questions into the control panel on your screen, and we will read it out loud for Tori to be able to give us an answer. So let's go ahead and get started with our first question. So the patient I care for is my husband, and I've tried to be helpful throughout his diagnosis and his treatment, and he has been very closed down emotionally and does not want to talk about his diagnosis or treatments, and I feel like he's holding it all in. How can I as a caregiver support him when he won't open up or share how he's feeling?
That's a really great question, and it can be really challenging as caregivers when we see someone who we love who is really struggling, and we want to be helpful and we want to be supportive, but that person might just not be ready to accept the support that we are willing or able or want to offer. I think that's a common experience, especially when we think about, treatment for depression or anxiety. Talk therapy and therapy in general is, unfortunately still stigmatized. And so people might feel reluctant to engage in that kind of support, even though, many of us do know that that can actually be really helpful. I think the difficult position that we find ourselves in sometimes is, the age-old saying, we can bring a horse to water, but we can't force it to drink. And what I would encourage you to do is everything that you're already doing. It sounds like you are being as supportive as best you can, letting your husband know that you are here for him, that you're here to help him process his diagnosis and any kind of stress that accompanies a change in your life and a threat to your health. You're there for him. You're there for him personally. You're there to help brainstorm, to help research, to help get him connected to providers if he's interested. And I think just the idea of just being present and just being there and letting him know that you are available, that you love him, that you care for him, that you want to support him. Sometimes that doesn't feel like you're doing anything, but you are actually doing something very important. You're normalizing for him that this is a challenging circumstance. You're validating how he's feeling. And you're meeting him where you're at. You're respecting that he's not quite ready to talk just yet, but that when he is, you're available. And I think you're doing a great job. And I would just encourage you to keep doing that.
Wonderful. Thank you so much, Tori, for that excellent answer. We have a few more questions coming in, so we'll just go ahead and dive into the next question. The next question is, I have to work to support us and my wife as she can no longer work with her lymphoma and the treatments she's receiving. I guess the husband is unable to care for her as he wants to and can't attend the appointments or help her travel, and sees her really struggling with fatigue, but there's no one else to really drive her or attend her appointments with her. Is there a way that she can get some type of support or assistance to be able to help her with this?
Great question. Again, I think this speaks to the challenges that so many of our caregivers face, that being, wearing these multiple different hats and having all of these roles and responsibilities that are pulling you in all different ways. You've got a sick spouse, but you also have a full-time job and you have to, work to make a living and put food on the table. And, your boss might not understand that you have to be at the hospital to support your wife, or for whatever reason, if you're just not able to attend appointments or you can't drive. So it's really important to sort of figure out what resources are there available in the community to help. So, and sometimes it's you got to get a little creative. So with regards to transportation, things like the Canadian Cancer Society Wheels of Hope program can be hugely helpful for, just alleviating the burden of actually driving to and from doctor's appointments. If your wife is, I know you mentioned that she's fatigued, and so if she's okay to get into a car, once she arrives at, I'm speaking from the Odette Cancer Center perspective, for our patients who don't necessarily have a family member coming with them, and they are getting here by Wheels of Hope or another means of transportation, and they're feeling weak, we can always have a volunteer come and meet them at the car and escort them to their appointment with the doctor or to their treatment. And that just takes a little bit of coordination, but it is definitely possible and can help, help both patients and caregivers feel comfortable. In terms of other, other resources, there is, other programs like I didn't mention this, but the Shine Through the Rain is another charitable program that offers financial reimbursement for the cost of transportation. So if Wheels of Hope was not available and you were in a bind and you couldn't get your wife to her doctor's appointment, you could send her in a taxi and collect your receipts and then meet with a social worker, and we could submit an application to the Shine Through the Rain Fund for reimbursement of travel costs. So there are, these are challenges of balancing, being a caregiver and also the other responsibilities. In terms of, actually being at the hospital, depending on your job, a lot of patients now in COVID, they have to attend their appointments by themselves because they're limiting the caregiver participation. And so what's happening now is a lot of our conversations with the oncologists, even though the patient is coming alone, the conversations are extending virtually to family members. So if you wanted to participate, but you couldn't because you couldn't physically be here, there's always the possibility of asking, your partner to just call you and put you on speakerphone, so that you can at least hear the conversation that she's having with the doctor and participate and ask questions. And so, being virtual has its limitations, but it also has its benefits in being a little bit flexible to have caregiver participation when, that person is also fulfilling other responsibilities like being at work or school or something like that.
Okay, great. Thank you so much, Tori. That was a really great answer. The next question we have is, how can I get access to a social worker? Are they primarily reserved for patients, or do caregivers get that same right? Just how does that process work?
Great question. So again, my apologies on the limitations of my my knowledge, but I'm speaking specifically about resources at the Odette Cancer Center. So here we have an entire department, a patient and family support department, where we have all kinds of staff, including social workers, dietitians, psychologists, psychiatrists, occupational therapists, an entire team of staff dedicated to supporting both patients and their caregivers. And so if your loved one is a patient here at Odette, then the best thing to do is to just come down to the patient and family support office. You'll give the administrative staff your partner's health card number or medical record number, and they will connect you with a social worker or a psychologist or whoever it is that you feel would be most beneficial to meet with for support. I do know that other cancer centers across Ontario, across Canada, of course, have social workers, and we can't separate patient from caregiver. We recognize that it's a package deal. And so, the patient is the one experiencing the treatment and the workup and the diagnosis, but it really does have an impact on caregivers. And so, I'm confident, even though I can't speak with 100% certainty about, our partnering hospitals or our colleagues across Canada, I am confident that their social workers and their team would provide support to caregivers. It would just require, a request. And if for whatever reason a social worker is not accessible in that department, there's lots of community support available too. Like I mentioned, through Wellspring, through the Canadian Cancer Society, the Lymphoma Society. So if for some reason you're not able to access social work support or support at your partner's cancer center, then there is support available in the community as well.
Great, thank you so much for the answer. And just kind of a follow-up question to that is if the hospital that they're at doesn't necessarily have a social worker, is it even possible to be referred to a cancer center to get access through that social worker program versus going into the community? Is that something that has been done at Sunnybrook?
So the patients and caregivers at the caregivers that we see at Sunnybrook are specifically caregivers who are connected to the patient being treated here. So unfortunately, we would not be able to support, caregivers for someone who's a patient at a neighboring hospital or in another province. It's limited to the caregivers of the patients who are being treated here.
Okay. And another kind of question that came up is if a patient isn't necessarily introduced to a social worker, they might not know that they have the option of being connected with a social worker. So how would they just go about trying to find this information? Because if they're not told by their doctor, they might not get access until much later in their treatment when it could have been very beneficial to be connected to one earlier.
Yeah, great question. I think it's one of those things where you sort of have to, if you're not automatically referred by your doctor, it's one of those things where you have to know about it to access it. And it's just a simple conversation with your doctor, just to say, who is just, learning more about your care team. Who is involved in my care team? If I need support, who can I reach out to? How do I access that person? So, a lot of, in today's healthcare system and in today's patient and caregiver experience, there is a lot of self-advocacy that takes place. And it's important to speak up, for yourself and your needs. And if you're struggling, talk to your doctor. If you're not sure about, if you have a social worker on your team, or how to seek help, you're seeing, at minimum, you are seeing that your loved one is seeing the doctor. And so it's important to, hopefully you have a good rapport with that physician, and feel comfortable being vulnerable, and asking for help, and that person will know very well about what supports, who are the members of the interdisciplinary team, and refer you that way. But yeah, it's just takes a question.
Great, thank you so much. So the next question we have is, would you be able to share what the major differences are between a social worker and a psychologist, and how these can be beneficial to have both, or just, focus on one depending on what your needs are?
Yeah, great question. So social workers also, we do a lot of different things. We wear a lot of different hats. So my role varies. I do everything from concrete resource connecting, to emotional support and counseling, for both patients and caregivers. So I'm referring people to home care services. I'm helping them get connected to financial support. I am arranging transportation. And then I'm also, I meet with patients and caregivers who are newly diagnosed and very distressed over this acute change in their health. Patients and caregivers who are having anticipatory anxiety about upcoming scans or lab work or appointments. So it's my role is variable, and the way that specifically it differs from psychology, I would say, is the psychologists are experts and specialize in mood and mental health. And so while that is certainly an aspect of the care that I provide, if somebody is looking for more of a long-term, sort of in-depth investment in their emotional and psychological health, I would probably recommend connecting with a psychologist or a psychiatrist. Whereas, social workers like myself, we of course offer emotional support to patients and their caregivers, but it's not as in-depth. In-depth is not necessarily the right way to describe it, but it's not as I'm losing my words. I apologize. It's more short term. It's more short term, I would say. Yeah.
Great, thank you so much,
Sorry,
Corey.
I lost my thoughts there for a second.
That's okay. That's okay. So I think that's actually all the questions that we've had, and it was a really great amount of variety that we had in the questions, and I think it really helped to give a little bit of extra support to all the things and wonderful things that you brought up during your presentation today. So I wanted to go ahead and then begin to end this session by first thanking you, Tori, for taking the time to share your expertise and knowledge about caregivers, how they can help themselves, and how they can really help the patient. And I want to thank all of the caregivers that have joined us in the audience today who participated and asked questions and shared their experiences as well. If you do have any follow-up questions, please feel free to reach out to us. You can contact us at info@lymphoma.ca for more information. And as a reminder, we will be posting this recording on our website to be able to refer back to and use as a resource. Please feel free to watch it again if there was something you missed, or if you wanted to share this with a friend, family member, or colleague. If they were unable to join, they can then go ahead and watch this at their convenience. You will be sent an email later this evening with the link to access this recording, but it will also be posted on our website as well. We hope you learned a lot from this presentation and continue to use Lymphoma Canada as a resource for education and support. You can watch the recordings from all of our webinars and educational forums, as well as our conferences, on our website by going to lymphoma.ca and accessing the educational webinars and forums page under the resource tab. As a final thank you, we greatly appreciate your time and expertise, Tori, and thank you greatly for providing our Canadian lymphoma community with more information about caregiving. Thank you for joining, everyone, and we hope you have a wonderful evening and stay safe. Good night.
Thank you.